All right, welcome back to ABA Exam Review and the continuation of our BCBA Mini Mock Exam series. Today we are covering personnel and supervision management, or personnel management and supervision, as requested by the commenters. If there's something specific you would like us to cover, please leave a comment below and we will get to that in a future mini mock. As always, subscribe so you get all of our video updates. Check out behavioranalyststudy.com for all of our study materials, including our combo packs, which include our practice exams and study guides. As always, let's work hard, study hard. Let's get going. Two supervisees are working toward BCBA certification. Supervisee X comes from a graduate program with extensive practicum experience and strong faculty membership. Supervisee Y completed an online program with limited practical training and struggled to find quality fieldwork placements. Both are at 800 supervision hours. How should the supervisor approach goal setting for the remaining supervision period? So the first lesson on personnel management and supervision is you want to treat your supervisees, whether those are RBTs or BCBAs or future BCBAs, like you would treat a client. We are going to try to assess them. We're going to create goals. We're going to try to measure behavior, and everything has to be personalized and individualized. Not everyone is the same. None of our clients are the same. We know that. Neither are our supervisees. Now, if we have supervisee X, extensive practicum, strong mentorship, and supervisee Y, who didn't get the same exposure and mentorship, and both need 200 supervision hours or however many supervision hours to complete their program, how would you approach goal setting for each supervisee? A, set the same goals focused on board exam content areas, since both need to pass the same test. Well, clearly, supervisee X and supervisee Y have very different backgrounds. And board exam content, passing the exam is not the only goal of a supervisee, right? Too many people focus just on the exam and forget that once you pass the exam, you actually have to go be a behavior analyst. So we can't just focus on board exam content and push them through the exam without actually training. B, assess current competencies for the supervisees and develop goals addressing those needs. That sounds pretty good, right? We would approach any client with a probing and a baseline and develop goals based on needs. The easiest way to handle these questions is to think about your supervisees as clients. And we're going to do the same thing here for X and Y, who are very different. C, focus supervision on supervisee Y's deficits while allowing supervisee X to work more independently. Now, just because X has all this experience and mentorship doesn't mean they're perfect or that they've even gained anything from it. So just going off this without any sort of assessment or idea of their competencies, we're making a decision to focus more on Y, when maybe X is severely lacking in parent training or something along those aspects. So we have to go through the process first of figuring out individual needs. D, provide identical experiences to both supervisees to avoid any appearance of favoritism. We can't worry about this as BCBAs. You're in a role of a boss, a manager, a trainer, and you've got to do what's best for your supervisees, just like you would do what's best for the client, regardless of this idea or perceived favoritism or whatever it might be. You've got to put all that to the back, or on the back burner, and focus on developing good, strong supervisees. How do we do that? We look for their needs, their competencies, and develop goals that are personalized. During a supervisee contract discussion, a supervisee states she prefers text message feedback immediately after sessions rather than formal meetings. The supervisor is concerned this won't provide adequate documentation or allow for deeper discussion. What should the supervisor do? When we are working with supervisees, especially BCBA supervisees who are training to become BCBAs, there's got to be contracts in place, right? And a lot of problems that arise during supervision could be fixed up front if contracts are done correctly. Now, in this discussion, the supervisee says she wants text message feedback and no formal meetings. And that's probably how a lot of supervisees feel, because those formal meetings, there's a lot more pressure. But the supervisor correctly is thinking, well, that's not going to be enough for a deeper discussion. Now, think about collaboration, right? We've got to collaborate and we've got to meet in the middle somewhere so it works for both of them. What should you do as the supervisor? A, agree to text feedback since accommodating supervisee preferences builds rapport. Okay, but we can't just discount the idea that we're going to lose out on adequate documentation or deeper discussion. Text messaging is not going to be enough. B, refuse text feedback and require formal meetings per standard supervision practices. Okay, but if the supervisee does like that immediate feedback, think about a client. If the client wanted immediate feedback, you more than likely would find a way to do that. So we've got to meet again in the middle. C, propose a hybrid model. Brief text feedback for immediate issues and schedule meetings for comprehensive review. Then document this agreement in the contract. That last part is so important. Write the contracts and don't be lazy about them. So when something does come up, because inevitably something will come up with one of your supervisees at some point, you've got an agreement, as you should, that says this is exactly what we're supposed to be doing. This is what I'm doing. C, hits all the boxes. D, allow text feedback initially but transition to meetings once the supervisory relationship is established. The beginning might be the most important, right? Where you're really trying to develop that working relationship and really trying to work with the supervisee to improve them. So we don't want to just skip out on meetings in the beginning because it's easier for everyone involved. It's not about what's easy. It's about what's doing the right thing and creating good BCBAs for our clients. So hybrid model, brief text feedback, and meetings, and document in the contract is the most thorough approach. A home-based ABA company notices that clients whose technicians receive weekly behavior analytics supervision show an average of 15% greater goal achievement compared to clients whose technicians receive only monthly check-ins. The clinical director wants to implement weekly supervision agency-wide, but is met with resistance from behavior analysts who claim they don't have time. What is the most evidence-based argument for prioritizing supervision? So this is a good exam question because we've got to work each question in a bubble, right? It's not about what you would do given a totally separate situation. We're looking at the information provided here. Home-based company sees that technicians who receive weekly supervision just perform better, right? More goal achievement versus monthly. So obviously that's going to be more time for the analyst because they don't have time. They never have time. BCBAs are busy. But we want an evidence-based argument for prioritizing supervision. What would that be? A, monthly supervision meets minimum requirements, so weekly supervision is unnecessary. Well, that's not what the question asked. It's looking for a good argument for prioritizing that supervision. B, improved client outcomes justify reallocation of BCBA time from direct therapy to supervision activities. Sure, our evidence here is weekly check-ins, a lot better client outcomes. That's ultimately why we do this, for better client outcomes. That's ultimately the only reason we're working, right? And whatever we can do to create better client outcomes, we can do. So if we have to transition from less direct therapy to supervision, maybe that's what we need to do. And that is based on this 50% greater goal achievement data. Technicians will be more satisfied with their jobs if they receive more supervision contact. Well, there's no evidence there. Some technicians may not want that at all, right? Nothing in this question states this is evidence-based. D, more frequent supervision reduces the agency's legal liability in case of client complaints. Again, going by this question and the information, they don't talk about legal liability at all. So we can't say that's evidence-based without more proof. So here we are going to look at the idea that improved client outcomes will justify reallocation from direct therapy to supervision activities. A behavior analyst supervisee consistently implements behavior intervention plans with high fidelity during direct observations, around 94%, but parent reports indicate problem behaviors are worsening at home. A performance diagnostic reveals the supervisee collects data accurately, implements procedures correctly when observed, but rarely reviews data between sessions or adjusts programs based on client progress. What does this suggest? So let's think about what the information in the question is showing us, right? Supervisee is collecting data accurately, implementing procedures correctly, but what aren't they doing? They're not reviewing data and they're not adjusting. And as we know, treatment plans are organic. They're always changing and shifting based on need. So even though fidelity is very high, if it's not doing anything it's not effective, what does it matter? So what does this information suggest in the scenario? A, the supervisee has a skill deficit in program modification and needs training on data-based decision making. Sure, they're collecting the data good or well, they're implementing well, but they're not making adjustments based on data. And that's what we do. The data drives our treatment planning and our treatment adjustments. Read all of your answer choices. B, the supervisee's behavior is under faulty stimulus control, performing correctly only when supervision is present. Now be careful, right? It does say they do implement correctly when observed, but it doesn't say anything about when not observed. So we can't necessarily say they only perform correctly when supervision is present. We do know they don't review the data or adjust programs. So information that we do know points towards a skill deficit. See, the parents are not implementing strategies correctly at home, which is outside the supervisee's control. Nothing indicates that at all. Parents only report increase in problem behavior. See, the BIP itself is ineffective and needs to be redesigned by the supervising behavior analyst. Well, again, we don't know, right? And completely redesigning it rather than adjusting based on the data isn't as efficient, right? And remember, the new task list focuses a lot on efficiency. It's much more efficient to take the data we've collected and adjust based on that rather than trying to redesign an entire BIP when we're not doing this one or we're not adjusting this one correctly. So information suggests skill deficit in program modification and training on a data-based decision making. All right, let's finish with an easy one. A supervisor wants to improve a technician's ability to implement natural environment teaching during play-based sessions. The technician understands the principles but struggles with fluent application. What sequence of performance management procedures is most likely to be effective? It's a good example here of how you'll get some long questions, some tiring questions. That's why when you get an easy question, you need to trust your prep and your fluency and pick the best answer and move on, right? We're not overthinking the easy ones. So if we're looking for the sequence of performance management procedures for a technician who struggles with fluent application, what might that be? A, feedback, practice, modeling, reinforcement. What's wrong with this? Well, in my experience, what people fail to do way too often is they fail to model. And modeling always comes first. We don't ask them to do something or our supervisors to do something and then give them feedback and then model. We have to model it first so they actually have an idea of what they're trying to accomplish. B, practice, feedback, reinforcement, modeling. We definitely don't want to model last, right? And we don't want to reinforce practice that may be wrong. C, modeling, practice, feedback, reinforcement. Start with modeling, let them practice, then feedback, then reinforcement. Task clarification, reinforcement, modeling, practice, same issue. Modeling needs to come first when we are dealing with training. All right, thanks for watching. That is the next part in our mini mock series. If you have a specific idea or task list item or subject you want us to cover, please comment below. Other than that, check out our website for all of our study materials. Work hard, study hard, and we'll see you soon.